Okay, let's dive right into this explainer. Today, we're going to take a really close look at one of the world's most devastating, yet entirely preventable parasitic diseases. It's a condition that has literally plagued humanity for centuries, but thanks to modern science and a massive global effort, it's actually one we might see disappear in our lifetime. Look, we all know mosquitoes, right? We usually just swat them away. It's a minor annoyance, a quick pinch, maybe an itchy bump. But what if one single bite carried a hidden threat that could permanently alter your body, disable you, and actually isolate you from your community years down the line? This isn't some science fiction movie. For a massive portion of the global population, this is a very real, everyday risk. To wrap our heads around the massive scale of this issue, just look at this number. Right now, over 657 million people across 39 countries are currently threatened by this exact scenario. It's a staggering figure. We're talking about hundreds of millions of lives hanging in the balance, living in endemic areas where one simple mosquito bite can lead to a lifetime of suffering. Section 1. The hidden parasite, a microscopic invader. So the disease itself is formally known as Lymphatic Filariasis, or just LF for short. It's classified as a neglected tropical disease, and it's primarily caused by a parasitic worm called Wuchereria bancrofti, which is responsible for about 90% of all cases worldwide. These are incredibly stealthy nematode worms that specifically target and permanently damage the human lymphatic system. And as you probably know, that system is absolutely crucial for managing fluid balance and fighting off infections in your body. The parasite's life cycle is honestly wild. It starts when a mosquito bites an infected person and ingests these immature larvae called microfilaria. Those mature inside the mosquito. Then, when that mosquito bites a new human host, it actually deposits the larvae right onto the skin. They slip into the body through the bite wound and migrate straight to the lymphatic vessels. Now, here's the terrifying part. They grow into adult worms that can live inside a human's lymph system for up to 8 years, mating and producing millions of new microscopic offspring just to keep the whole cycle going. Moving on to Section 2, the human toll, beyond the clinical terms. The really tricky thing about lymphatic filariasis is that most infected people appear completely asymptomatic at first, but underneath the surface, subclinical damage is already happening to their lymphatic vessels. Eventually, for about 30% of infected individuals, chronic and severe manifestations develop. This includes lymphedema, which is severe swelling, usually in the legs, but it can affect the arms or breasts too. In men, it frequently causes hydrocele, a severe fluid accumulation in the scrotum that affects roughly 25 million men globally. Over time, recurrent bacterial infections can turn this lymphedema into advanced elephantiasis, which leaves people with incredibly painful, thickened skin. But these physical impairments go way beyond just the physical pain. They carry a profound social stigma. Because of the visible deformities, individuals are frequently isolated from their families, shunned by their communities, and physically unable to work. It basically traps entire families in a relentless cycle of poverty and mental anguish. Because of that, the crucial point here is that true treatment isn't just about handing out pills. The World Health Organization really hits the nail on the head here. To truly prevent disability and alleviate suffering, we have to use a holistic approach. These patients need access to psychological support, hygiene education to prevent secondary infections, and social programs to actually foster their reintegration into society and economic life. Section 3. Testing and diagnosis. Finding the unseen. Okay, this is where the biology gets super fascinating, but also kind of a logistical nightmare. The microfilaria, those baby worms, circulate in the blood, but they are nocturnal. They're actually most active in the bloodstream between 10 p.m. and 2 a.m. Seriously. So traditionally, doctors have literally had to do night blood smears, drawing blood in the middle of the night just to spot them under a microscope. Today, thankfully, we also have serologic tests that look for specific IgG4 antibodies indicating an active infection. And incredibly, doctors can even use ultrasonography to look at the lymph nodes and see what's called the filarial dance sign, which is exactly what it sounds like, the actual movement of living adult worms inside the human body. Section 4. The medical arsenal. Striking back. So how do we fight back? Well, we rely on 3 primary weapons. First, we have ivermectin, which works by paralyzing and clearing out the microfilary. Then we have DEC, which also aggressively targets and kills those circulating baby worms. And finally, albendazole, which disrupts the adult worm's microtubule function, effectively sterilizing them and inhibiting their reproduction altogether. For the longest time, the gold standard treatment was a 2-drug combo known as the DA arm. using just DEC and albendazole. But recently, science has given us a major upgrade. By combining all three drugs into a single therapy called the IDA arm, ivermectin, DEC, and albendazole, health officials can achieve a much faster, superior clearance of the parasites from the blood. This triple drug therapy is a total game changer because it significantly shortens the number of years a community needs to be treated to completely stop the transmission cycle. And to make absolutely sure these powerful drug therapies are both safe and effective across diverse populations, researchers rely on really rigorous cluster randomized trials. They identify endemic communities, randomly assign them to either the standard 2-drug DA therapy or the new triple-drug IDA therapy, and then meticulously track the participants for 36 months. They monitor for adverse events in the first week and test efficacy at 12, 24, and 36 months just to guarantee those parasites are truly cleared out. Let's zoom out a bit. Section 5, Global Elimination Efforts, a historic campaign. Check this out. Since the global program to eliminate lymphatic filariasis began in the year 2000, an astonishing 9.7 billion, yes, billion with a B, cumulative treatments have been delivered. Just think about the logistics of that for a second. Distributing medications safely and effectively 9.7 billion times to some of the most remote and under-resourced communities on the entire planet through mass drug administration programs. It's incredible. And the economic ripple effect of this effort? It's staggering. By preventing the severe disabilities caused by ELF, these treatments have averted an estimated $100.5 billion in lifetime economic losses for some of the world's most vulnerable populations. That is money staying in families, allowing parents to work, and letting children go to school instead of acting as full-time caregivers. Which brings us to Section 6, the path to 2030, ending the cycle. The global progress we've made is undeniable. Since 2000, we've seen a 74% decline in global infections. Because of these successful mass drug administrations, 871 million people have been entirely freed from the threat of this disease. They no longer require preventative chemotherapy. 14 countries have already officially eliminated it entirely. Now the target is set for 2030 to see elimination validated as a public health problem in 80% of all endemic countries. So as we push hard toward those 2030 elimination targets, armed with better triple drug therapies and a truly global coalition, we really have to ask ourselves a profound question. Are we ready to be the generation that finally ends this? Will we be the ones to consign this ancient, devastating parasite to the history books forever? It's a massive challenge, for sure. But for the first time in human history, the end is actually in sight.